How to make a great living practicing medicine even after Obamacare. The time to start marketing your practice is now. But the problem is you don't know where to start. Well, I'm going to help you with that. But before I do, you may want to know, who is this guy and why should we listen anyway? You should listen because I know how to fill your schedule with the exact patients that you want to treat. I can make your offices as busy as you want them to be. I've been doing medical marketing since 1999. The average relationship I have with a client lasts longer than 10 years, and I'm pretty proud of that. In fact, my clients have become some of my closest friends. My results-based approach always begins with a focus on the client's desired outcome. And people seem to like that. So with your specific goals in mind, let's have some fun. In fact, we're going to go on a fishing trip. Creating successful campaigns is not complicated. We focus on 3 factors. We need bait to go fishing, and the bait will represent our message. The fish represents our market, and the water, our media. Our message is going to represent what we sell. What do you want to sell? Wrong. When you try to sell too much in a campaign, most often you end up selling nothing at all. Let's ask again. What do you want to sell? As you ponder this question, consider that the best place to start is with your most profitable or your most popular offerings. If we hope to catch some fish, the best bait to use must grab the attention of our prospect. The market represents who your ideal patient is. Who does your target market consist of? You may think that it's everyone and anyone, but you'd be wrong. Casting a wide net can cost a fortune, and there's a good chance that you won't even get a nibble on your hook. So identify as many demographics as possible. How old is your ideal patient? What is their gender? What kind of work do they perform? What are their interests? What kinds of things do they spend money on? Do they use their email or surf the web? How often? Now that you know what you're selling and to whom, all you have to do now is throw your hook in the water with the proper bait. And before you know it, you've hooked your limit. It's easy to nail your target every time when you know where they are. If you're fishing for walleye, don't bother going to the ocean. You'll catch your limit every time if you use media with a good reach of the Great Lakes during May. To quickly review, Step 1 is to hone in on what you're selling and develop your message. Step 2 is to clearly define your market. And Step 3 is to identify the media you will use to most effectively get your message out to your market. Now, the biggest reason that most doctors fail is because they start with the wrong step. And it usually involves a salesman standing at the door yelling about a deadline. And here's what inevitably happens. Lots of cash gets wasted. Here's how every physician can build an unending, steady stream of highly targeted, profitable new patients. PackYourWaitingRoom.com, where you'll learn how to build a marketing machine that works 24 hours a day, 7 days a week, even while you sleep. I look forward to seeing you there. Pack Your Waiting Room Medical Practice Marketing.